Hi everyone, my name is Tammy Russell, and today I'm going to talk to you about Vibrant's wheat zoomer test. Looking back in our own history of wheat consumption, two of the earliest types of wheat are emmer and einkorn. Evidence of emmer wheat consumption dates back to about 23,000 years ago and has been found in Israel. Since then, domestication of the wheat plant has altered its below and above ground communication, forcing it to change its system of roots and networks. More recently, hybridization of wheat began in the 1960s and escalated in the 1990s to improve yield and disease resistance. There has been a lot of controversy about wheat and/or gluten consumption. It is known that gluten triggers an immune response which can lead to damage of the intestinal villi, causing nutrient malabsorption and deficiency with the development of autoimmune diseases and chronic diseases such as rheumatoid arthritis, osteoporosis, seizures, infertility, nerve damage, migraines, irritable bowel syndrome, inflammatory bowel disease, diabetes, and ataxia. Some practitioners and research feel that gluten is difficult to digest, and many people may be lacking in the right quantity of hydrochloric acid and/or digestive fire to properly bring it down. We do have to ask the question, are we allergic to food, or are we just allergic to what has been done to it? And in thinking along that vein, researcher Dr. Stephanie Seneff wrote a paper a few years ago called Glyphosate Pathways to Modern Disease, Celiac, Sprue, and Gluten Intolerance. In that paper, she suggests that glyphosate is the most important causative factor in the etiology of celiac disease, and that glyphosate affects the following. It can increase the ratio of pathogenic resistant bacteria to commensal beneficial bacteria. It can inhibit the conversion of active vitamin D in the liver. It can reduce mineral availability by chelating much-needed cations, and it can compromise the pathways of detox in the liver by affecting CYP enzymes. But wheat can also be a health food. Are there benefits to eating wheat? Whole wheat is a significant source of fiber. It's a good source of minerals, iron, and B vitamins, and it can also help to grow healthy bacteria in the large intestine. I know in the 70s, 80s, and 90s, many nutrition educators were all about promoting whole wheat products as opposed to refined white bread products such as Wonder Bread. We do have to consider, though, the incidence of celiac disease and non-celiac gluten sensitivity, as both of these are skyrocketing in our population. Until the 1970s, the estimated global prevalence of celiac disease in the general population was 0.03%. The current estimated prevalence is 1%, with a statistical range of probability of 0.5 to 1.26 in the general population in Europe and in the USA. With non-celiac gluten sensitivity, it's more difficult to assess. It can be extrapolated from the percentage of IBS sufferers, which is 16 to 25% of those in Northern Europe, that about a third of this population is thought to have non-celiac gluten sensitivity. More recently, in looking at 713 wheat zoomer reports, 83% of these showed sensitivity to wheat and/or gluten. There are many broad spectrum symptoms of non-celiac gluten sensitivity, such as abdominal pain, brain fog, diarrhea or constipation, headache, fatigue, leg or arm numbness, depression, bloating, neuropsychiatric disorders such as autism and schizophrenia. The proposed mechanism is thought to be a primary alteration of the small intestinal barrier, leading to abnormal absorption of gluten peptides that can eventually reach the nervous system, stimulating the brain opioid receptors and/or cause neuroinflammation. It's important when thinking about celiac disease or gluten sensitivity to make a discernment between the two, and there are differences. Celiac disease is defined as possibly being a genetic autoimmune disorder triggered by gluten. It's characterized and diagnosed by measuring the atrophy, degradation of the microvilli in the intestinal wall, usually done by a small bowel biopsy. The average person spends 6 to 7 years from the time that they first develop symptoms to diagnosis, and 83% of them are misdiagnosed initially. It is thought to occur out of every 133 Americans, or 1% of the population. With gluten or wheat intolerance, there's no true clinical definition. The technical definition of non-celiac gluten sensitivity is that you feel better by taking gluten out of your diet. This could be linked to gluten or non-gluten components of wheat. The consumption can lead to a wide range of symptoms and complications, often unidentified. There is limited diagnostic testing, and is thought to affect 1 out of every 7 Americans, or about 43 million people in our country. The Wheat-Zoomer test is an amazing, advanced, futuristic test which is able to look at many different items that helps put together a comprehensive clinical picture for your patients. It is the most accurate and sensitive blood test for celiac disease. It can also look at intestinal permeability. It looks at non-celiac gluten-associated autoimmune diseases affecting the skin and the brain. Wheat allergy is often shown on this test, gluten sensitivity, non-gluten wheat sensitivity. It also looks at total immune response by measuring total immunoglobulins, IgG and IgA. There's also a novel research biomarker that looks at early celiac development 4 years earlier than when it would normally be diagnosed. What makes Vibrant's Wheat-Zoomer test different? Well, its ability to diagnose gluten sensitivity and such a high accuracy in diagnosing celiac disease. The incidence of non-celiac gluten sensitivity is skyrocketing and has been projected to have a prevalence of up to 3/4 of the US population. A recently published study by Vibrant looking at 713 Wheat-Zoomer tests showed gluten sensitivity in 83% of those test subjects. Current competitor testing does not cover the full spectrum of Gliadin isoforms. They do not examine other proteins in gluten, such as glutenin. They do not assess immune system response or show the response to the lectin content of wheat. The Wheat-Zoomer test displays an immune response to 18 wheat proteins at the peptide level. In a landmark paper published in conjunction with Johns Hopkins University and the Mayo Clinic, the Wheat-Zoomer technology is highlighted, tested, and explained. It can also be thought of as microchip and antigen technology. Vibrant developed a novel set of epitopes derived from gliadin that have a high degree of accuracy in differentiating celiac disease from controls compared with serologic tests. The final discontinuous epitope sets were tested in a confirmatory cohort of celiac disease patients and controls, yielding 99% sensitivity and 100% specificity. In other terminology, the paper states that using a silicon-based microarray platform with multi-pillar chip, peptide sequences of all native and deaminated gliadins, which are known to trigger celiac disease, were synthesized in situ and used to identify peptide epitopes. The Wheat-Zoomer test assesses the immune response in an individual. It does this by looking at total IgA and total IgG. 1 out of every 500 people have selective IgA deficiency. IgA antibodies fight infections in mucous membranes of the body. 2% of those with celiac have selective IgA deficiency, and IgA deficiency increases the risk of autoimmune response to gluten by 10 to 20 times and can produce a false negative on serum testing for celiac. IgA also has a half-life of about 7 to 10 days, and it is produced by tissues that are usually respiratory in nature, saliva glands, tear ducts, and mucosal in nature as well. So it's an antibody more targeted towards the intestinal mucosal lining. There are also benefits of testing IgG testing, to doing IgG testing with the Wheat-Zoomer. The IgG is the most abundant type of antibody. It's found in all body fluids and protects against bacterial and viral infections. By detecting possible low levels on the Wheat-Zoomer report, an assessment of potential false negative results can be made. IgG results can be affected by any medication that affects antibody levels, such as steroid therapy. So if somebody has really low IgG, then you can't trust the results on the test as being accurate, and you have to assume that they could be false negative. What's really cool about the Wheat-Zoomer test is this tissue transglutaminase DGP fusion peptide. It is denoted as a promising new early indication marker. It provides anywhere from 14 months to 4 years a celiac diagnosis, meaning that somebody could be diagnosed 14 months or 4 years earlier than they would have normally been through routine methods. So with this fusion peptide, Vibrant has built a novel gliadin peptide and cross-linked it with the tissue transglutaminase enzyme, whereby gliadin gets deaminated and a fusion peptide is created, also known as a neoepitope. Vibrant's microarray technology allows for antigen synthesis with over 100 different combinations for cross-linking, whereas competition only usually gets about 4. The autoantibodies to this fusion peptide might be a better indicator of disease potential than antibodies to either tissue transglutaminase or DGP alone. Also, antibodies develop in an earlier window related to disease progression, and this helps with better correlation with intestinal mucosal damage. It minimizes potential for cross-reactivity with other predictive antigens, and it's useful in the presence of IgA deficiency and in the pediatric population. Vibrant also does intestinal permeability testing, which is offered as a standalone test. This is really helpful when your patients have symptoms that can be grouped or classified in 3 different areas, such as digestive, systemic, and autoimmune. We've all come across patients that suffer from immune conditions such as inflammatory bowel disease, irritable bowel syndrome, and food sensitivities. They might also have systemic problems such as depression, anxiety, migraine headaches, muscle pain, chronic fatigue, anxiety, mood swings, brain fog, as well as micronutrient deficiencies. They may have autoimmune manifestations such as celiac disease, rheumatoid arthritis, type 1 diabetes, asthma, and Hashimoto's thyroiditis. The consequences of a leaky gut happen when foreign particles such as undigested proteins, toxins, harmful bacteria, yeast, and fungi can now enter the bloodstream. This can cause inflammation, nutrient deficiency, malabsorption, and possible autoimmunity, such as thyroid, rheumatoid arthritis, and lupus. With our intestinal permeability test, zonulin levels, as well as blood antibodies to zonulin, actin, and LPS are measured. In a healthy intestine, a protein called zonulin is the mortar and holds together tight junctions between the intestinal cells to establish a protective barrier between the stomach and the bloodstream. Gluten, or better known as gliadin, as being the troublemaker, breaks down zonulin and thus tight junctions, making the gut more permeable, also known as leaky. Vibrant has isolated F-actin for a more accurate picture of the immune response of the anti-actin antibody. F-actin is found only in intestinal epithelial cells, also known as smooth muscle, and has a critical role in structure and function of the intestinal cells, as well as the regulation of tight junctions. F-actin acts as a contractible belt to pull apart or seal the adherence junctions. Antibodies to actin can identify the degree to which intestinal destruction is occurring, but can also be indicators of autoimmune disease, such as connective tissue disease, as well as autoimmune hepatitis. Lipopolysaccharide is produced by gram-negative enterobacteria. It is a very potent endotoxin, which can incite and drive systemic inflammation. It is an indicator of dysbiosis and leaky gut. And a practitioner can check additional clinical labs, such as cardiovascular, inflammatory markers, and markers for diabetes and insulin resistance. The practitioner can also consider running a Vibrant gut simmer to identify the source of dysbiosis. And just keep in mind that there could be the presence of pathogens in the gut creating toxins that don't register as lipopolysaccharide on this test. They could be toxins other than LPS. The wheat germ agglutinin is also found on the wheat Zimmer test. This is the lectin component of wheat. People may have a pattern of reactivity or sensitivity to other dietary lectins if they have a sensitivity to wheat germ agglutinin, but this is not seen in all patients. This is not a compound of gluten, and this can interfere with vitamin D absorption at the cellular level of transcription. So if a patient has an elevated marker for wheat germ agglutinin, it would be wise to try to get their medical records to see if they're also vitamin D deficient or have the patient be tested for vitamin D. Wheat germ agglutinin can also be used as an additive in supplements. The wheat Zimmer test also looks at differential transglutaminases. These are other than tissue transglutaminase 2. These still indicate a gluten-mediated autoimmunity, but it may not manifest symptomatically in the gastrointestinal system. Transglutaminase 3 is correlated with skin manifestations of autoimmunity, such as dermatitis herpetiformis, eczema, and psoriasis. Transglutaminase 6 is correlated with the neurological symptoms of autoimmunity in the cerebellum, such as gluten ataxia, gait abnormalities, and balance and coordination issues. These are other ways to see if somebody is reacting to gluten on the skin or in the brain. The Wheat-Zimmer test looks at gliadin, gluteomorphin, and prodynorphin, which are all proteins found in gluten. Gluten is a superprotein complex made up of gliadin and glutenin. Gliadin tends to be the more reactive portion of gluten for most people. It is certainly the troublemaker. Gliadin has the most research behind it and is binding to tissue transglutaminase 2 and celiac, as well as binding to zonulin to precipitate a leaky gut. Most gluten sensitivity tests on the market only look at the alpha-gliadin IgG, whereas the Wheat-Zimmer looks at all the isoforms. Gluteomorphins are the peptides found in wheat that react with opioid receptors in the brain. This can indicate that a patient may have a much harder time withdrawing from gluten when they're trying to eliminate it. Prodynorphin antibodies can be an indicator that a gluten-induced reaction to the signaling hormone is produced and may interfere with mood or other functions of prodynorphin in the body. So if a patient has an elevation in prodynorphin, I will often ask the practitioner or the patient if they have had a history of mood swings. The Wheat-Zimmer test also looks at the type 1 hypersensitivity IgE reaction to wheat. It is rare to see this elevated on the Wheat-Zimmer, and this value does not usually decrease when wheat is eliminated because IgE antibodies remain elevated in the long term after the initial exposure has been established. Glutenin is the other part of the gluten protein complex. It's less common that people react to it, but some people still do. This panel allows Vibrant to look at the full spectrum of reactivity to glutenin from high to low molecular weight. There is no clinical difference between the two. And having an elevation in any of these markers indicate a gluten sensitivity. The Wheat-Zimmer test also looks at the proteins in the wheat plant that are not from gluten. Up to 30% of the proteins found in wheat are actually non-glutinous. These can be serpins, farinins, globulins. And this is really what helps to make the Wheat-Zimmer test more unique. Proteins in the wheat unrelated to gluten, but still clinically relevant to the immune reactions. Some individuals are more reactive to the wheat proteins than to gluten itself, and often this requires a little bit of extra clinical education. People have a hard time understanding that there are other proteins in the wheat plant that they could be reacting to. But interestingly, 10% of those that react to wheat on the Wheat-Zimmer test react only to the non-gluten proteins. Consider that the competitor testing does not offer this option, and people might be reacting to wheat via the non-gluten proteins and have no idea based on their previous testing, only looking at gliadin or gluten. Luckily, the Wheat-Zimmer test is now available for the pediatric population. If the test is run on a patient that is under the age of 18, it will automatically run as a pediatric sample with the appropriate reference ranges. The Wheat-Zimmer has been shown to have overlap with autoimmune disease. The National Institute of Health estimates that more than 20 million people in the United States have an autoimmune disease, and there are more than 80 autoimmune diseases that have so far been identified. Anti-nuclear antibody, also known as ANA, and extractable nuclear antigens, ENA, are recognized as diagnostic features of systemic autoimmune disease. Wheat sensitivity is increasingly correlated with many disorders, and there is a much higher frequency of celiac disease in those with Hashimoto's thyroiditis, Graves' disease, Addison's disease, autoimmune insulin-dependent diabetes, and autoimmune hepatitis. This panel shows the ANA antibodies as well as the ENA panel. This is used in the CTD connective tissue disease test offered by Vibrant. Recently, Vibrant published a study in Biomarker Insights examining the blood of 713 subjects with a Vibrant ENA11 panel and a Vibrant Wheat-Zimmer for trends and prevalences of antibodies. They found that the positive ENA markers are present in only about 2% of the general population. However, positive ENA markers are present in 29% of those with celiac disease and 27% of those with gluten or wheat sensitivity, highlighting the possibility that gluten is very much related to autoimmune disease. To sum up the Wheat-Zimmer test, it is superior technology offered at the peptide level, microchip-based. It provides highly accurate and confirming data to support the elimination of wheat and gluten from one's diet. Additionally, the results offer a unique opportunity to examine tight junction integrity and immune system strength so that a plan for healing can be more readily and is easily assembled. Here at Vibrant, we like to offer very generous support and resources. We have the Vibrant clinical team made up of very knowledgeable, resourceful, very available clinical dietitians and clinical nutritionists that can explain the test results. They can also provide diet and lifestyle education if the practitioner desires that we do that. We have a very user-friendly Vibrant portal, which is full of webinars, guides, tutorials, and validation papers for our testing. We have an amazing Vibrant sales team that can provide information for the pricing methodology for the testing, as well as how to do the blood draws, which tubes to use, what direction to take on which test to order, and they can facilitate a response to clinical inquiries. It is often that we get questions asked over and over again, frequently asked questions about the Wheat-Zimmer test. I want to take a moment to just go over some of those FAQs. One of the most popular questions we get are what medications can interfere with the Wheat-Zimmer test result. As with all antibody testing, immunosuppressant and corticosteroid drugs can reduce antibody protection and cause false negative results. A patient should ask their pharmacist if their prescribed medications are immunosuppressant or steroid class medications. If so, it is recommended to wait 30 to 60 days after completing the prescription for it to clear the system and allow the normal production of antibodies. This is required for accurate antibody measuring. Do not stop these medications without instructions from your prescribing doctor. Here we have a list of immunosuppressive drugs. Inhalers can also affect test results. Wait 2 weeks after the completion of the inhalant dosage before collecting the specimen. Do not stop these medications without instructions from your prescribing doctor. Certain infections can also interfere with test results. For best assessment, it is important for the physician to evaluate the total immunoglobulins, IgA and IgG, to determine a patient's baseline immunoglobulin production and thus accuracy of a patient's antibody response. Total IgA and IgG are available on the Vibrant Wellness Wheat-Zimmer test. Another question that we get is fasting required to run the Wheat-Zimmer test? Fasting status will not influence the Wheat-Zimmer results, and the majority of Wheat-Zimmer measures antibodies to antigens specific for celiac disease and gluten non-gluten wheat peptides. Fasting status may influence the serum zonulin levels. The Wheat-Zimmer measures both serum zonulin and zonulin antibodies. Serum zonulin can elevate following a meal, particularly after a meal containing gluten, and it can stay elevated for up to 6 to 8 hours. Another question we frequently get is, are certain foods that are thought to be cross-reactive with gluten likely to influence the Wheat-Zimmer results? Vibrant Wellness Wheat-Zimmer is a peptide-level microarray platform where IgA and IgG antibodies are measured against wheat peptides. Because peptides in foods are highly specific to the food from which they are derived, remember that peptides are the smallest combination of amino acids joined together. They cannot induce cross-reactivity or be confused by the immune system for another food protein. Another question that we get is, why should my patient with autoimmune disease have a Wheat-Zimmer done when they have no GI symptoms? Well, 15 to 20% of people with celiac disease have no GI symptoms. However, because of villus atrophy, they are not absorbing nutrients efficiently, so their condition may worsen, or they may develop another autoimmune disease. And another question we get, when should I retest after doing the Wheat-Zimmer test and going off wheat gluten and wheat? It is ideal to avoid wheat gluten for at least 4 months prior to the next test. However, for socioeconomic and or other reasons, it might be more suitable to wait 6 months to a year prior to doing another Wheat-Zimmer test. I want to thank everyone for joining me today. It is a pleasure for our Vibrant team, our sales team, our support team, and our clinical team to help you as much as possible in your journey with ordering Vibrant tests. We're here to answer any questions and walk you through doing your first test or second test, and we're here to help your patients as well. Thank you for your time, and I hope you have a wonderful day.